Yes, I just would like to grab your attention for this great session because it's really a pleasure to host you today, a special session on advocacy and patient right. And we are going to look into how to translate the right to be forgotten into real changes at national level. And we have Kinga Wojtowicz. And this session will explore practical tools and the right to be forgotten. She will run into interactive session, so don't be shy. She will give a presentation and also ask you some questions while she goes. And we will prefer in this session also that you raise your hand more than put questions on Slido. So Kinga can also, reply to the questions during her speech. Thank you and welcome on stage Kinga from Ending Discrimination Against Cancer Survivors.
Thank you very much, Kara, and thank you to the organizing team for inviting me and hosting us in this beautiful city, Vienna. Kara already introduced me brilliantly, but just a little bit of a word about myself. My name is Kinga Wojtowicz. I'm based in Brussels, and over the last 6 years, I've been working with a Belgian oncologist, Françoise Meunier, also based in Brussels, on the topic of ending discrimination against cancer survivors, or how otherwise you can know right to be forgotten for cancer survivors. I actually have 3 objectives of this session. So Chiara already mentioned I would like to make it as interactive as possible, to introduce you, to tell you a little bit more about what the right to be forgotten is, what we have achieved so far at the European level, but also at national levels. I know here we have we have representatives from different countries, which is extremely interesting for our initiative, because I would really like to connect with you just to see how further we can advance the legislation in the countries that it's already existing, but also how to introduce it in the countries that do not have protection for cancer survivors. And lastly, I would also, Dr. Meunier, as part of this initiative, continuously is looking for additional testimonials. So if you know someone who has been discriminated in the past, I would really like to connect after the session to stay in touch. So during this presentation, I will walk you through those different pieces, and I will also be asking questions here and there just to really get to know you, and after that we can have a further discussion. So as I mentioned, Dr. Françoise Meunier, she's a retired oncologist. She has been working in the medical field for the last 45 years. She is a former director of URTC, which is a organization that is specializing in research in cancer research. So she knows the area very well. And why she got involved in this initiative already 10 years ago, in 2015-16, is because through her entire experience, she got to know the patients, and she saw that even after the treatment, they still were discriminated. And whereas the oncologists would say, you're treated, you can get back to normal life, you're no longer a patient, enjoy your life, the past medical history would still follow them. So that's why she, after retirement, she still is very much engaged and pushes the agenda both at the European level and at the national level. So before I actually start, can I ask you to raise a hand if you've ever heard of the right to be forgotten for cancer survivors? Brilliant. Okay, so I don't have to spend too much time on this, but in case I saw that there was still a few hands that were not raised. So cancer is no longer a death sentence. This is something that we know, and every single year there is more cancer survivors. It is estimated that currently in Europe there is approximately 20 million cancer survivors, and not all of them are protected. There are inequalities existing in Europe, not only when it comes to diagnosis, treatment, but also when it comes to the protection of cancer survivors. So here, there's a data showing that cancer mortality has fallen by 25%, and it's a very significant one. The reality is that whereas medical data has improved, the discrimination still persist. So this is a very straightforward message, right? If you're going to the government, if you're talking to politicians, this is a no-brainer. Yet there's still governments that believe it's difficult to implement that law. So here, together with what I said when it comes to cancer no longer being a death sentence, we have looked into different messaging that we can present to policymakers, to different governments, and we've also collaborated with a very renowned lawyers and former judges, and we also realized that this right to be forgotten is not about ensuring discrimination, but also this is a basic human right. It's about dignity, it's about equality. So from that perspective, it's really important that I outline it, because this is not something that people believe that this right to be forgotten is. Here there's a lot of things that we did at the European level. Again, with Dr. Meunier, we've been working over the last couple of years, and as part of this, we were part of conversations with 3 different legislators in Brussels that are responsible for the implementing or development of European law. So we've been engaging with the European Parliament, we've been engaging with the European Commission, we've been engaging with different representatives of the member states. So as part of that, we've been in plenty of bilateral discussions trying to push agenda forward. We are in different conferences at the national level trying to also encourage patients to speak to the policymakers, to bring the community, to speak to also different societies and bring this topic at the forefront of the agenda of different governments. So there's many tools that we've been using at the European level: public consultations, bilateral meetings, community building, many statements we've been publishing. But process in Brussels, and it will not be shocking for everyone, but it's quite lengthy, and you have to wait a little bit time to see the results. So that's why in parallel we are also working at the national level and building or empowering patients or directly reaching out to the ministries, those who are keen to engage in English, because this is also not so evident for many countries. So when it comes to the achievements, 5 years ago we have managed to include the right to be forgotten in European Beating Cancer Plan. So this is a very important initiative that is continuously being implemented. We've also included that in the cancer mission. So there are European renowned researchers who are really looking at implementing of the right to be forgotten. And one of the most important ones in terms of binding legislation is Consumer Credit Directive. This was a success, but at the same time, I wouldn't say a failure, but we would like to see it moving forward better. Why? The Consumer Credit Directive is a directive that looks at consumer credit. So buying a car, buying a smaller item that is not a mortgage or is not threshold is approximately 20,000. This is the very first legislation that has included the right to be forgotten, a European legislation that is currently being implemented at the national level. So that sparked discussions at the national level, and a lot of policymakers are aware of the right to be forgotten, which was not the case before. The downside is that at the final stages of the discussions, closed-door discussions between the Parliament and the Council, so discussions that third parties are not part of, and we not know who pushed for different years, we have 15 years, so not 5 years, but 15 years. Because the right to be forgotten, according to the most recent medical data, tells that the right to be forgotten should be implemented as of 5 years after the end of treatment. Not 15, not 10, but 5 years, because after 5 years, you are medically cured. So if you are medically cured, you should not be discriminated. Here I would like to mention why we are calling it Ending Discrimination Against Cancer Survivors, because when it started, it was the right to be forgotten for cancer survivors. So a lot of policymakers and a lot of communities would often confuse it with GDPR rules, which is not the same thing. The right to be forgotten states that after 5 years or 10 years, depending on the legislation, cancer survivors are no longer obliged to inform about the medical past. So this is completely different about the GDPR rules that we have through the legislation. So our remaining objective is to have a harmonized binding legislation at the European level. And here we are looking at bigger loans, right? So we are looking at getting a mortgage, looking at getting life insurance. So this is an aspect that we are keep pushing for at the European Commission, but this is not easy, considering that we would like to change the legislation for the insurance sector. And we know very well that the insurance sector has more resources and has army of lawyers. If I often like to say that, simply sometimes it's quite difficult to fight, considering that from our perspective, we just have a very strong message and we have community with us. So here with that, I would like to ask another question. So right now, as you know what the right to be forgotten is. It's a part. It's really making sure that after 5 years you're no longer obliged to inform about your medical history. May I ask if we have in this room cancer survivors who have been discriminated in the past when it comes to getting medical insurance, being denied medical insurance? I have 1, 2, 3, 4. And from which countries are you from, if I may ask? Ireland. Spain. And the third person, I'm not really sure if you... Belgium. Okay. So these are good, these are countries where the discussions already happened. If I may ask, in which year were you trying to get the insurance?
After diagnosis, I was trying to get health insurance, and I couldn't get it. I needed to be 5 years out from cancer, and we also couldn't get a mortgage because I couldn't get life insurance because I needed. Well, at that time, there was no right to be forgotten. But in Ireland, it's 7 years, it's not 5 years. They're supposed to be bringing it to Cabinet, but they haven't done that. So it's still 7 years.
Thank you.
I couldn't get a life insurance and medical insurance in that moment. Finally, I could, thanks to one friend that was involved in an insurance company, but it took time. But I know that now it's approved in Spain, this law, yeah.
It was in 1998 that I was excluded from the hospital insurance from the family because of breast cancer.
Thank you very much for sharing your stories. And indeed, you mentioned that in Ireland, in 7 years, Ireland is a very, I know that things are moving in Ireland, but Ireland was one of those countries, or is one of those countries, when there is a code of conduct, so non-binding legislation, whereas in other countries, there's a binding legislation obliging insurance not to have in a medical questionnaire questions about your past medical history. So there's one thing about having the law, and there's a second one about making sure that it's fully implemented. So here I have a good overview as to how things are standing in Europe. So at the beginning, just a little bit of a story. So France was definitely a pioneer when it comes to the right to be forgotten. The very first law came in 2016. So I would like to make a pause that it's been 10 years that the very first legislation happened in Europe. And 10 years later, we still have not even half of the Europe covered about that. We have half of the population, but when you're looking at the countries, there are still inequalities between the Western countries and Central and European countries. Following France, we had implementation law in the Benelux. So again, we saw different levels of implementation. France started with 10 years because that was a very first case. The advocacy effort started in 2010, so thanks to a great effort of oncologists and patient organization that is called Rose Up. So the organization of breast cancer patients, they managed to introduce the very first right to be forgotten in 2016. Benelux countries then followed, following by Portugal and Italy, and then after that, a few years later, we had other countries following. So Romania, here Slovenia, we have also Cyprus. So right now we have 10 member states who have the right to be forgotten. Now those 10 member states have different levels of the right to be forgotten. So, and there was also a very different ways of implementing the right to be forgotten. And I like using Spain as an example, because Spain was the country that introduced the right to be forgotten following the Consumer Credit Directive, and that I've just mentioned. But also it was introduced very close to the political, to the elections. So it was rushed through a little bit. It took 3 months to implement it. And in a way that the law simply was adopted, it didn't work because the industry was not involved, the patient community was not involved, oncologists were not involved, but the right to be forgotten was introduced, right? So it took approximately 12 months for different communities to bring together and making sure that it actually is workable at the national level. So not only do we have different years of the right to be forgotten, but also we have different years for those who were diagnosed with childhood cancers. So a few countries, and here I will, it's in Romania, Portugal, Cyprus, Slovenia, and Belgium that there is a differentiation between the right to be forgotten for survivors who were diagnosed in their adult life, and there's a shorter time for childhood cancer survivors. Together with that, those countries, you can see a good overview when it comes to the years that are existing right now. So, for example, France, although they implemented the 10 years threshold, they moved to 5 years 2 years ago because they realized that medical data produced also by European Society of Medical Oncology said that it's no longer 10 years, it's 5 years. So thanks to the great work that they did, they changed to 5 years, and Belgium also followed what the French did. Together with that, what is also very important to note is that a few countries, additionally to having the right to be forgotten, have so-called reference grids. These are the documents developed by oncologists that list countries, that list cancers, which do not require, of which survivors do not require to wait 5 years. It can be 2-3 years, depending on the cancer. So these countries have implemented those grids, and these are Belgium, France, Italy, Netherlands, and 1 month ago, Portugal also joined them. So this is a really great, implementing tools that allows cancer survivors to reduce that time, because when you're 30 years old, 5 years of waiting to get a mortgage, it's quite significant time. So if we have a difference between 1, 2, 3 years, it's simply better. So with that, I would like to note that together with Dr. Meunier, we are really much involved in countries where there's still no right to be forgotten, in Poland, Ireland, and Luxembourg. So for example, Luxembourg, where there's a code of conduct, so non-binding legislation, they are currently looking at changing it to a fully binding legislation. The proposal is still on the table, but it takes also time to be implemented. In Poland, so my home country, it's been almost 2 years that the ministry is working on the right to be forgotten, which in my humble opinion is a little bit too long to have it implemented. And Ireland is also moving in the right direction. So I know that at the ministerial level there was a proposal, and they are looking at implementing a law at 5 years, not 7 years, but 5 years, both for cancer survivors of adult cancers, but also childhood cancers. So they're doing a great job there. And they also will be holding presidency of the EU, so I really hope the needle will be also moved thanks to them and a good case study that they have. So this is where I will stop, and happy to take any questions, either from the room or I know also we have audience online.
Yes, we can start maybe with with some questions that we received from the audience, and then feel free to ask your own questions. We have one that says, is it the right to be forgotten not in conflict with EHDS initiative? So the European Health Data Space, I think is what you meant, right?
Yeah, I do not see how it will be in the conflict.
Because you are sharing your data. So in a way, you are sharing your data, and the data are also stored to be used also in other countries. So that's why it's like, if your data are shared, then what happens, I think, is what I get out of it, is like, will you forget the data that were shared?
That's actually a very good question. And the data to be shared under the European Health Data Space is a data that you allowed for your treating doctor to be seen. We are talking about medical questionnaires. So I'm certain that many of this room applied for a mortgage, and then you have to get a life insurance together with a series of documents that you have to sign. You have a medical questionnaire. So questions about smoking, physical activity, and then past medical history. This is where you either have to declare or don't have to declare. So insurance or banks do not have access to your medical data, and never will they have access to your data under the European Health Data Space.
Yeah, go ahead, Diego, because
Yes, that's a very good point. I mean, because that's something that we have found, at least in my organization. We need to differentiate what is the right to be forgotten and the medical register. I mean, for example, we doctors need to know if we have had cancer 10 years ago, 15 years ago, because if you have had cancer, you cannot donate blood, for example. So that doesn't mean that it's going to be disappear in every register. It's about legal and social aspects of our lives. It's not about healthcare. I mean, just to clarify, because this is something that I have to clarify a lot with some patients. Yeah.
That's a wonderful remark, and also one of the reasons for which we no longer call it an initiative on the right to be forgotten for cancer survivors, but ending discrimination.
The other question is, what is the definition of a cancer survivor for EDACS? Should the cancer treatment be stopped?
So the definition of a cancer survivor is that after the end of treatment, so at the end of treatment, if there is a no relapse, after 5 years, you are considered a survivor. So that's an official definition by which we are going and which we are seeing in different legislation at the national level.
Other question is how reducing years from 10 to 5 comes together with prolonging hormonotherapy in breast cancer treatment from 5 to 10. So how you can reduce basically from 10 to 5 and with prolonging hormonotherapy. I'm getting the question correct? Because then I'm confused about numbers. Who asked the question? Yeah.
Could
maybe
you
clarify it. Yeah.
Yes, so right now it's the trend in European Union for women with breast cancer who have hormone therapy to have it not for 5 years but for 10 years based on recent researches. So that's why I think that in case they still receive this therapy, they are not like survivors because maybe this cancer will return.
I'm not really sure I have a full answer to this question. However, I believe that this is exactly why we are developing reference grids, because such exceptions will be found in the reference grids. So one of the best countries who are doing that is France and Belgium, and I know that there's many exceptions for breast cancer patients. And as such, I would have to look into those specific grids on how oncologists see those specific cases. But this is one of the reasons for which we want more countries than 5 to have reference grids and look at the different types of cancer.
I think we cleared all the answers, so if you want to continue with your presentation or you want to open more to the floor.
Absolutely, absolutely. I move forward to a good case study here in France. So recently there was a very good paper published looking at how the law has changed the reality. So here the question that the researchers were looking at is how different things changed for cancer patients, but also for the general population that here is identified as controls. So here there are three main categories. First is that an applicant was denied an insurance. Second was that they had to pay extra premium, and when we are talking about extra premium for mortgages, we are talking about additional 15,000 to 20,000 euro additionally to a mortgage. And the third part is that simply they were not even eligible to be recognized as applicants. So you can see the right to be forgotten does work. Of course, we would like to get to those numbers. However, as you can see, it declined by more than a half in several cases. So 10 years it works in France. As Dr. Meunier often says, no insurer went bankrupt. So it's not hurting the industry, it helps patients. So this is a very good, straightforward story. What is needed now? There's always a political will. If there's a political will, there will be a solution. And for example, in Romania, the right to be forgotten was introduced simply because there was a very, I'm not really sure if we have someone from Romania here in the room, but there was a brilliant senator that was diagnosed with pancreatic cancer, if I remember well. She's still with us, and she simply introduced this law. So there's a political will, there will be a solution. We have to share best practices. So as part of the ending discrimination, we have a repository of materials. So you will be able to find all the references, medical data, different papers developed by lawyers, developed by researchers, developed by academia, developed by different medical societies. So it's very important to keep sharing them. And it's very important to also make sure that there will be also a long-term follow-up clinic with dedicated healthcare professionals that will also be able to advise patients that such a law exists. How we can get involved. So first of all, I'm here. I would really like to connect with you all who would like to get involved at the national level. With Dr. Meunier on a weekly basis, we hold 4 to 5 calls with different patient organizations from different member states. Only today we connected with Latvia and Luxembourg just to understand what's going on. So we are really active and supporting at the national level. So first of all, we would really like to connect with you all. Understand the testimonials, collect the testimonials from yourself, from people you know who are discriminated, because these testimonials, collecting videos, is a very powerful tool that we can use when contacting the government. As I mentioned, we also have a repository database on our website, which we keep updated on a daily basis, not annual basis. And yeah, please stay connected. Please share the word about the right to be forgotten, because even if the law exists, survivors do not necessarily know of that. And before I finish, I also will share a personal story that last year I've applied for a mortgage and I live in Belgium. And Belgians changed the law from 10 to 5 years last year. So 10 years after that, my insurance still asked me if I had any history with cancer over the last 10 years. And this is where I informed them that they are not complying with the law, that it should be 5 years. So really this awareness and being active does matter, because the next person may have not known that and they may simply be denied the insurance. Thanks a lot, and I hope that I'll be able to connect with some of you.
Thank you, Kinga. And if you don't mind, we have additional 2 questions, and since we can be flexible with the time, I want to give the members this space to ask. So, what does the UK protocol say about the right to be forgotten?
The UK protocol. That is a good question. I'm certain there is no legislation on that, but I know that there is a specific voluntary based where insurance can choose whether or not a specific case is eligible for insurance or not. So it's really up to the clinician to evaluate whether or not they pose a risk to insurance. But this information I've checked more than 10 months ago, so if there's anyone from the UK who has recent updates, I'm also very happy to hear that.
10 months is not that old though.
10 months is not that old, and I feel like if there would be something, I would also know.
Yeah.
But all is certain is that there's no legislation, and everything depends on whether or not your oncologist will evaluate you as a risk or not, and later on whether the insurer will evaluate you as a risk.
And can the right to be forgotten be legally refused for scientific reasons, for example?
No, because the scientific society has evaluated, and I believe it was last year that ESMO published a paper that the production of this paper took more than a year just to make sure the data is correct. So from the scientific societies, the threshold of 5 years is justified. And this also helps us to bring the 5 years threshold to the national member states. And it was really timely. It's very important from the perspective of the Consumer Credit Directive, which is, for example, currently also a big discussion in German Bundestag. And I met a colleague from Germany, and indeed, thanks to this Consumer Credit Directive, discussions in Germany have started. And Germany is not an easy country simply because the insurance sector is very much present in Germany. So it is in Austria and Switzerland. So as such, even though we connected with medical societies in Germany, with patient organizations, it was very difficult to launch the discussion. And if I may also ask you to look at the LinkedIn of Dr. Meunier, because there is a German patient organization that is collecting currently signatures to formally bring forward to the Bundestag a request to have the right to be forgotten for cancer survivors. So everything is available on the website, and recently, and this petition was reshared by Dr. Meunier a day ago.
Yes, last question we take. Yeah.
Yeah, I'm from the UK, and just wanted to, raise this point. Life insurance, and there is also medical insurance for travel, and probably both fall in the same sort of a league. And I'm just saying, from what we did in the UK with our charity, we spoke to an insurance company to see how we can at least reduce the incidence of cost of medical insurance. And we sort of got a 30% discount rate for our members. Now, just wondering, is this something which we can initiate together, especially with an organization like yours, along with Luce, approaching insurance companies, because it gives a lot of benefit to, all our patients across Europe. So, like a joint effort, if we could do that, that could be quite useful. And I'm just seeing from the small experience we had.
Thank you for sharing that experience, and I'm a strong advocate of being in touch and in discussions with the insurance sector, because from our perspective we also try to understand how it impacts their business, and I've spent many hours with Insurance Europe. So this is a European organization of insurance and reinsurance, so the industry that insures the insurers. After many hours of discussions, we came to a conclusion that there's a data presenting the numbers that out of all cancer survivors, the chances of cancer survivors relapsing after 5 years of period is 5%. So we have 95% of the population that can live healthy life and will not pose a risk to the society as a whole from the financial perspective. Which I believe is a very big number, right? It's a really positive number. On the other side of the insurance, they told me, but for us, this is 5% of risk. So this is where we came to a conclusion that we cannot get to a point where they will agree for 5 years of the right to be forgotten.
The incidence and the probability of teenage boys speeding must be more than 5%.
Yes.
So, and I think maybe that we need to put these figures in context with other risk factors that they do insure for.
Precisely, precisely. Like the same. Also, I also had a discussion with this community yesterday that in the medical questionnaire there are also questions: Are you physically active? Are you a smoker? I don't believe that any of the smokers ever noted that they are smoking. And the insurance cannot prove that they have data because simply there's no such data for smokers, whereas there's one for medical data. So, and they are posing much more risk for the insurance than cancer survivors. But again, this is quite difficult to do from the messaging standpoint because we don't have data on that. And I believe that tobacco industry also will not create one for us.
Thank you a lot, Kinga, for your presentation, for replying to all the questions. You can still continue asking her questions. She will be around for a little bit. And I think we can just close this session, thank Kinga, and then we move on with Anna. Thank you.
Thank you.